Hi guys. Hi guys, and how are you doing? How is your week? If you haven't seen any of my other videos, my name is Raluca Negra, and I am learning to become a vet nurse. But the main subject of my videos is not becoming the vet nurse, which I think it's pretty awesome, or at least for me, it is pretty awesome because I love working with animals. But it's about cancer and lymphoma. I have a dog, a small dog, a Westie. He's 14 years old, which was diagnosed 1 month ago, a little bit more than 1 month ago. He was diagnosed with lymphoma. So since then, he's on a protocol. It's called the CHOP protocol. And it lasts for 6 months, and he gets every week a new medication administered. What I want to achieve through these videos is to create awareness about this kind of treatment, this kind of cancer for dogs, and especially to tell you which can be the side effects, what can happen, and also what you can go through when you find that very, very sad news. And yeah, it's hard. It's hard to go through it, and it's also hard to deal with all the side effects and everything that happens. So as far as I know, the side effects for dogs usually it's quite low, and many of the dogs that don't go through this kind of treatment, they don't have side effects. But somehow mine had, for almost any medicine he took until now. So first week he got administered through the vein, through the IV. He got administered vincristine. Plus he took everyday prednisone, 16 milligrams. Then the second week he was administered cyclophosphamide. That was through a tablet, and they lowered the dosage of prednisone. If I'm not wrong, yes, it got lowered to 8 milligrams because he had quite some side effects from it. So then they decided to make it lower. The third week he got again vincristine, and again some other side effects. And finally, last week he was administered Doxorubicine, one medicine which I was a little bit afraid of. Because I heard that it has quite some side effects, and also puking, a lot of vomiting. But surprisingly, it was quite well. I mean, every week there were some side effects. There was vomiting, there was diarrhea, there was neurological effects. What else? Lots of restlessness, panting from the prednisone, of course. Diarrhea, but not too much. It was, I think it happened 2 days or something, but not, yeah, I think twice it happened only. So I didn't have to give him any meds for the diarrhea. And the last week on Friday, he was administered with Doxorubicine, as I said, through an IV. It's also quite toxic, so then it needs to be carefully administered because it has the potential to damage the tissue quite a lot. But the tissue looks really great, doesn't have any problems from there, didn't leak the place where they put the catheter. The first 2 days he slept quite some, he slept a lot after he got it. And after that he was quite well, like I haven't seen, he didn't want to puke. I'm giving him twice per day medicine that's also for anti-nausea and anti-puking. So at every 8 hours in the morning he takes it before eating, and then after 8 hours later in the day. So he didn't puke, no diarrhea, and nothing else for now. It's already Wednesday. So things are quite well from this one. Haven't seen anything else since then. Well, he is a bit different than he was before, you know. I mean, he lost some weight as well since he started the treatment. I think he lost almost 1 kilogram or something, and he's quite a tiny dog, so then you notice it quite well. yeah, what else? Well, he's not that cheerful, you can imagine. And sometimes he's, you know, like staring on the wall and just a bit lost. Like, I don't know, like not present 100%. Yeah, but I guess this is just, I mean, he's still fighting cancer. I cannot really forget that. And he's still taking medicine, which is very powerful and very toxic in the end for all the cells in his body, not only for the cancer cells. So then, yeah, he cannot be 100% as he was before. Plus, he's already 14 years old, which is, well, he's a senior dog. For the rest, he's not going to get anything this Friday. He will have a week without any drugs, just to see how he's behaving and if it already, the cancer, if already entered into remission, into the remission stage. So we have to see how it's going to be his behavior, if it was going to be cheerful, better than during the treatment, and for sure if the lymph nodes get swollen again or not. That's one very, very important point to look at. So next week I will check the lymph nodes quite often and check his weight as well to see how is it going. Right now he's receiving prednisone only every 2 days. Because he was supposed to receive, I believe, 2 milligrams, and it's kind of hard to cut that pill in such a small amount. So then he receives every 2 days the same amount as he had the previous week, which was 4 milligrams. But of course, the side effects from prednisone got lower. It will be the last week he will receive prednisone, no more after that. And yeah, hopefully next week is gonna be good news and he's gonna be well, and well, to see, of course, improvements. And yeah, I really hope it's gonna be good results from this treatment. The blood test came out all right. I mean, taking into consideration that some of these drugs, they lower the white cell blood count, but nothing too worrisome. I mean, still in normal levels, let's say. Well, considering this treatment and that he's going through chemotherapy, I mean, they're not normal levels as they should be. But taking into consideration the treatment that he's taking, it's, let's call it normal. He has a small anemia, nothing too worrisome. And for the rest, they looked quite well. So that's a good thing to look at. For the rest, as I said, I will see how he's going to be the next week. And after that, the protocol will start again for another month. So we'll have again vincristine for the first week, it's cyclophosphamide for the second week, vincristine again for the third week, and then the doxorubicine for the fourth week. But this time without prednisone, that was given only in the initial stage, in the induction stage. And after this next month, it's going to be administered this treatment every 2 weeks. So let's hope the results will be great. And yeah, well, for now, no more infection, no need for antibiotics anymore. And yeah, this week, as I said, not really any bothersome or worrisome side effects. So let's hope it's gonna be the same. From vincristine, the vincristine last week, yeah, there were 2 days when he felt like puking. Very, very little neurological effects, but yeah, not that bad as the first time, of course, very little, and a little bit of diarrhea. With cyclophosphamide, the side effects were not very much present, so it was quite a good week, I think. And also with doxorubicine, not really, yeah, something obvious. I told you the first 2 days he was sleeping quite a lot, but then this thing got better. So until now, the worst one for him was vincristine, in the sense that he had many side effects from it. And of course the gabapentin, that was given extra, but we stopped it after the first intake because he was very wobbly and he had ataxia. Prednisone caused, of course, side effects, but that's the last week he's gonna take. so we got rid of it as well. Yeah, for the rest, that's it. And yeah, I want to wish you a really good week and a great weekend. It's approaching very fast. Yeah, a lot of strength for the ones that you're going through this as well in this moment, and hopefully things are gonna be well. And for the ones that don't, I'm very happy for you, and just check your dogs all the time. Take them at least twice or once per year to have some blood tests done, to be checked properly, an echo, maybe even heart echo or something, you know, to know that everything is working properly. A urine sample, it's really good from time to time to avoid all the stones and infections that can be caused by bacteria or everything else. Just check them all the time, at least once per year. After, maybe when you go for the yearly vaccine, just do this, please. It's gonna count. It's gonna make such a big difference. You don't even know. And you can, you know, you can avoid something or even prevent it, or I don't know, find something earlier, and it's gonna make your life so much easier later. So I know I might repeat myself, but really prevention is key, really. Prevention, prevention, prevention. Just echo, blood tests, urine samples, you know, everything that's necessary. And even if your doctor says, no, it's not necessary, he's a young dog, it's fine. Yeah, I had my dog, he was 4 years old, and he needed a surgery for stones, for bladder stones. He went into acute renal failure for that. So, yeah, I don't have anything against doctors. I believe there are many, many great doctors out there, but please do prevention. Not all of them do. So have a great week, and good luck for all of you. Bye. See you next time.